Hi, I'm Hannah Smithson. I'm Professor of Youth Justice at Manchester Metropolitan University and the Director of the Manchester Centre for Youth Studies. I've been involved in youth justice research for about 25 years. This work's involved interrogating and contesting the notion of youth gangs, evaluating the responses to children's antisocial behaviour, assessing youth justice responses to racially motivated offending, exploring the use of sport as a vehicle for young people's engagement with youth offending teams. I've also investigated the relationship between adverse childhood experiences and violence, and I've developed participatory approaches to the delivery of youth justice services. And very recently, I was involved in the UK's first study of the impact of the COVID-19 pandemic on each stage of the youth justice system. The past 8 to 9 years, I've worked in close partnership with each of the Greater Manchester Youth Justice Services. And this is part of the award-winning Greater Manchester Youth Justice University Partnership, or GMYJUP, as it's most commonly known. So as part of this partnership, I led a project that resulted in the co-creation with justice-involved young people of a new framework of practice called Participatory Youth Practice, or PYP, as it's commonly known. Now, PYP has been embedded in youth justice teams at a national level, and it's influenced practice at an international level. And the ideological underpinnings of PYP are based on participatory research approaches, including power sharing, valuing authentic understandings and lived expertise, and underlining the need for youth justice systems to be underpinned by an ideology of respecting young people's rights, responding appropriately, and enabling young people to contribute to the decision making around their own lives and the system's response to their offending behaviour. After all, children are the experts in their own lives. And what we're seeing at a regional level in Greater Manchester is that when you do this, the outcomes for children are much improved. The engagement levels are much improved. We know, and there is so much evidence, that compared to children in general populations, those entering youth justice systems are much more likely to have experienced childhood adversity. And we know that there's a relationship between adverse childhood experiences, such as physical and emotional abuse, neglect, and the witnessing of domestic abuse. And that there is this relationship between those adverse childhood experiences and things such as mental health illnesses amongst justice involved children. So the World Health Organization describes a public health approach as seeking to improve the health and safety of all individuals by addressing underlying risk factors. And they tend to be underpinned by 4 steps. And that is the consolidation of robust evidence, determining the causes and correlates of offending behaviour, robust evaluations of interventions, and implementing appropriate interventions in a variety of settings. I would argue that the overnight impact of the pandemic on youth justice systems revealed that they were ill prepared to cope. And this led to a proliferation of needs experienced by justice involved children. And these needs included a lack of services provided in the community, solitary confinement in the custodial estate, and substantial delays to court cases. Now, some adaptations and responses within the youth justice system to service and delivery brought unexpected benefits as well as challenges. Some of these may not be relevant in the post-COVID world in which we currently live, whilst others, such as repurposing the custodial estate for children, have never been more relevant. And I would suggest that there's an urgent need to develop a clear understanding of the pandemic on justice involved children and those who work with them. And this should be a priority for youth justice systems across the globe. By addressing the points that I've discussed, we could begin to tackle some of the glaring failures in the current system, including ethnic disproportionality, the school to prison pipeline, and the lack of specialised services for girls. So I advocate for a whole system approach to addressing children's needs, because disjointed services ultimately result in disjointed approaches.